So let's start preventive obstetrics, right? Now in preventive obstetrics, there are two type of care we provide to the mothers. We provide in preventive obstetrics, we provide care to the mothers. We provide two type of cares to the mother. What are the two type of care we are providing to the mother? We are providing preconceptional care and obstetric care. What is preconceptional care and what is obstetric care? What do you mean by preconceptional care? Preconceptional care is the care given to the females. It is given to the females. What care we are giving? We all are doctors. We are healthcare providers. We will educate the female. Regarding planned parenthood, family planning, regarding institutional deliveries, not home deliveries, and regarding the services and medical supervision we provide during pregnancy, and genetic counseling should be done before the pregnancy. So all this education we will provide before conception, before this lady become pregnant. So we are providing this service to the females which are not pregnant. We are providing them before their pregnancy, that is preconceptional services. And obstetric care means we are providing the services to the pregnant ladies. So care given to the female during the physiological pregnancy. So you can see two type of care is given: preconceptional care, which is given before pregnancy, and obstetric care, which is given during pregnancy. Now obstetric care is of two type. It is of two type: essential obstetric care and emergency obstetric care. You can see ESOC and EMOC. Essential obstetric care, you can appreciate essential obstetric care, and you can appreciate emergency obstetric care. What is essential and what is emergency? What is essential obstetric care? It is given care to the female before, during and after delivery till 42 days of the delivery. This is the normal care. During pregnancy we are giving the essential care. It is not emergency. This one is essential. Essential care is given during pregnancy, at the time of the delivery, and after 42 days of the delivery. Emergency care is given during emergency, any time during emergency during the pregnancy. Okay, so this is emergency care. Currently we will deal with the essential care today. Today I will be teaching you essential care. We divide the essential care into three portions: antenatal care, intranatal care, and postnatal care. What do you mean by antenatal, intranatal, and postnatal? So the care given from the point of conception, the lady become pregnant, till the start of labor. Is known as antenatal. It's before delivery. The care which is given during labor, from labor to delivery. Okay, from labor till delivery of the baby. Delivery. Maybe normal delivery, maybe cesarean section delivery. This is intranatal care. This is intranatal. This is antenatal care. This is intranatal care. And the care given from delivery. Okay, from the day of delivery, day 1 of delivery till 42 days of delivery. This is known as puerperium period. Okay, so it is postnatal period. It is postnatal. In postnatal, we give care to both the newborn as well as mother, not only to mother. Here we are giving only to pregnant lady, but here we are giving care to both the newborn as well as the mother of the newborn. How many of you got it? So we are going to deal with three type of care in essential obstetric care. So today I am teaching you preventive obstetrics. Okay, in preventive obstetrics I am teaching you essential obstetric care. We are providing three type of essential obstetric care. We all are doctors. So here you can see the healthcare provider, the doctor, the healthcare provider is giving this care. Who is giving this care? We doctors, the healthcare providers, give this care to the mothers, to the pregnant ladies. So from the point of conception till labor, it's antenatal. From labor till delivery, it's intranatal. And from delivery till 42 days after the delivery, it is postnatal. Give me a thumbs up. So this is the three type of care we are going to deal with. Let's start with the first type of care. Let's start with antenatal care. Now in antenatal, in your university exam, if you are talking about third prof university exam in which PSM is the lengthy subject, sometimes you get long question on essential obstetric care. So you are supposed to write all three. You are supposed to write antenatal care, intranatal care, as well as postnatal care. Okay, and sometimes you get individual question on antenatal or intranatal or postnatal. MCQ can be framed from any of them. So let's start antenatal care. First, I am teaching you antenatal care. In antenatal care, I will be teaching you all these topics. This is my overview in which all these topics one by one I'm going to deal. So let's start with the introduction. Tell me the definition of antenatal care. I already taught you. What's the definition of antenatal care? It is the care given during pregnancy to the mother. During pregnancy. We are giving the care during pregnancy to the mother. So it starts from the point of conception till the onset of labor. From conception till labor. You can see my 3 diagram. Okay. From conception till labor, antenatal. From labor during delivery, intranatal, and from delivery till 42 days of the delivery, it's postnatal. So this is antenatal, from conception till labor. Usually in rural areas, this health, antenatal, the main hero of the antenatal care is female health worker. Female health worker gives this care. Okay, this is the introduction. So usually not the medical officer, not the doctor, the female health worker, okay, gives this care at the subcenter or PSC to the pregnant ladies. So this is antenatal care, the care given during pregnancy, from the point of conception till labor, till the start of labor. That is, you can say during pregnancy. So there are 2 definitions. Either you say the care given to the lady during pregnancy or the care given to the lady from conception till labor. So meaning is same. So this is antenatal care. So you know the definition. What are the objectives? Why we want to give the care? Why we not directly meet the lady at the time of labor pain only? Before labor pain, we want to give some medical care to all the pregnant ladies. Why? What are the objectives? It helps in identifying the complication of pregnancy. So before delivery only, we will come to know the complications in pregnancy. Okay, maybe the pregnant lady have hypertension, maybe diabetes, or maybe any other complication. It ensures good and quality management at the time of the labor. It ensures healthy outcome for the baby as well as mother after the delivery. And it is important for well-being for the baby as well as mother. So that's why these are the objectives. We are going to give this care to the lady, to the mother, to the pregnant lady. It is antenatal care. It is known as ANC, antenatal care. Now you tell me, my next question, ideally, how many visits the lady should give during pregnancy to the healthcare service provider? So suppose there is a PHC, CHC or sub-center in a village, there is the lady who got pregnant. Okay, and how many antenatal visits she should undergo during the pregnancy? So ideally 14 visits. 14 times the pregnant lady should go to the hospital for checkup. Maybe it's a hospital, maybe it's a PHC, maybe it's a CHC, maybe it's a sub-center, depending. Okay, so she is going to health service center. Health service center can be anything. How many visits? How many visits during pregnancy? Total 14 visits. Ideally, she should visit 14 times in a normal, uncomplicated pregnancy. So for the first 7 months, once a month, every month. So 7 visits are these. Out of the 14, 7 are these. In the 8th month, twice a month. In the 8th month, so 2 visits are these. And in the 9th month, once a week. So there will be 4 visits and it will be 9 week, few weeks ahead. So 7, 8, 9, 10, 11, 12, 13 and it will be 14. You know, 9th week onwards till labor. So it is 1 visit per week. So you should learn the frequency for the first 7 months, in the 8th month, 9th month onward. In the first 7 month, 1 visit per month. In the 8th, 2 visits per month. In the 9th month onward, 1 visit per week. So it will be 5 weeks. So total it will be 14 visits. Ideally. Okay. But in periphery, it's difficult. You know, in the village, the pregnant ladies are not very aware, and ideally they don't do 14 visits. If everything goes well, you know, in periphery, the pregnant ladies do home delivery only. They don't go for the delivery even to the hospital. Okay, for antenatal visits, sometimes they don't even go for single antenatal visit. So what is the minimum? This is ideal. Ideal visit should be 14. But what should be the minimum antenatal visits? Minimum recommended by WHO. The minimum visits should be 4. As per Govt of India, there should be 4 visits. The first visit should be as early as possible. Early registration is done. The point the lady come to know that I am pregnant, she should go to the nearest health service center and do the registration of the pregnancy. That is first visit. The second visit should be between 14 to 26 week of gestation. 14 to 26. The third should be 28 to 34 week of gestation. And fourth visit should be 36 week onwards till term. So you have to learn the 4 visits. The minimum visit should be 4. But in 2016, the WHO has revised the minimum visits is 8. According to Govt of India, the minimum visits is 4. Okay, so there are 3 questions, 3 answers. Tell me ideal visits. Ideal number of visits. Tell me the minimum number of visits by Government of India, GOI. And tell me the minimum number of visits recommended by WHO. Tell me the three answers. Ideal visits are always 14. Ideal are 14. Okay. Minimum visits by Government of India are 4. And minimum visits by WHO are 8. Say, people say, these are your MCQs. Say, got it or didn't got it? I'm talking about ANC visits. The ANC visits. Ideal visits, minimum visits recommended by Government of India, and minimum visits recommended by WHO. Say, people, got it? So you have to learn the 3 questions and 3 answers. Clearly, no confusion. If they are asking ideal, no confusion, it's 14. It's 14. If they are asking minimum, now there is a catch. Okay, you have to watch the options. In the option, if it is 4, go with 4. They are asking for Government of India. But in the option, if it is 4, 8, both are there. You have to see whether they are asking the recommendation of Government of India or the recommendation of the WHO. Okay. So you know the definition of ANC. ANC is the care given during pregnancy to a pregnant lady. That is the care given from the point of conception to the onset of labor. This care is known as ANC. You know the 4 objectives of that. I told you the 4 objectives. I told you ideal visits are 14. I told you minimum visits according to Government of India it's 4 and according to WHO it's 8. Now tell me the protocol. What we are going to do on these visits. I'm a doctor. Okay, I'm telling the lady, the pregnant lady, I'm working as a medical officer in a village. In a periphery, in a village, I'm working as a medical officer. I'm a doctor. Now, in the village in which I'm working as a medical officer, a lady got pregnant. Okay, and you know, there is awareness in the ladies that anyone who got pregnant, they should inform to the nearest health service center. So they are coming to the PSC and informing me that, madam, I got pregnant. So what I am going to do? What is the protocol? What are the guidelines? In which antenatal care visit, what I am going to do? So basically there is a fixed protocol. There is a fixed protocol that we doctors, the healthcare providers have to follow during ANC visits for the pregnant ladies. Okay. So during first visit, what we are going to do? Must do. We have to do certain investigation and what counseling we are going to do. What things we have to do, what investigations we have to do, and what counseling we have to do. And at all other visits, apart from first visit, what we are going to do. Let's start with the first visit. Suppose I'm a doctor at PSC and there is a lady in the village who is coming to me, informing me that, doctor, I got pregnant. Now what's next? What's next? So I will say the lady, first of all, confirm the pregnancy. Okay, how the lady came to know that she is pregnant? Maybe she has performed the UPT, urine pregnancy test at her home herself. Or maybe she missed her menses. She missed her menses, her menstrual period. And she is, you know, having a doubt that she is pregnant. You know, the first sign of pregnancy is missing of the menstruation. Okay, so maybe she is not sure. So first we will confirm the pregnancy with pregnancy detection test at the first visit. It's our responsibility to confirm that. Okay, so these UPT kits are provided free of cost by the government at all sub-centers, PSCs, CSCs. These are provided. These are by the name of Nixche. Okay, these kits are provided free of cost. We will give this one of the kit to the lady and ask her to confirm by putting few drops of urine over here and get confirmed that actually she is pregnant or not. If she is pregnant, I will give her MCP form to fill. I will fill the form for her if she is uneducated. So fill the mother and child. What is MCP form? Mother and child protection form. So this form filling is compulsory. So I am filling the form for this lady. Okay, I'm filling the form for this lady. The name of the form is MCP, Mother Child Protection Form. Okay, and I will do the registration in ANC register. There is a ANC register which is maintained at sub-center level. Okay, this is an ANC register in which all pregnancies of the villages are registered. So I will do the registration in the ANC register and I will fill this form and give this form to the lady to take it with her. Okay, the filled up form, okay, given along with the booklet, you know, safe motherhood booklet to the woman to read it. If she is educated, she should read the instructions given in the safe motherhood booklet. Okay, I will inform if she is having any past illness, past history, past complication, any previous pregnancy before this. I will take all the history. Okay, I will do the physical examination, general BP, height, weight, respiratory rate. Is there any pallor? Is there any jaundice? Is there any edema? I will examine the breast. I will see the respiratory system and CVS. I will do all the systemic examination as a doctor generally. Then, you know, the 2 doses of the tetanus, depending when the lady is coming. I will give you the details of all of them. First, you see the instructions. Okay, we will give the tetanus. We will give the tetanus, you know, immunization, the vaccine. There are 2 doses has to be given. The first dose will be given depending when she is coming first time. So these are must dose during the first visit. So during the first visit, you know, with the help of images, it will be easy for you to learn. With the help of images, it will be easy for you to learn. In the first visit, what are must things? In the first visit, confirm pregnancy with UPT. fill MCP form. Okay, the fill MCP form, sorry, this one, fill MCP form. Do registration, do the registration in ANC register. Then do the general checkup, BP and all, and give tetanus vaccine if applicable. I will tell you when it has to be given, the 2 doses. Then what all investigations you are going to do in the first visit? In the first visit, we need 5 investigations. Okay, 4 of them in the blood and 1 of them urine. Urine routine microscopy. Okay, urine routine microscopy, simple routine microscopy just to rule out UTI. Okay, and in the blood, we will do hemoglobin estimation. We will do blood grouping. Number 1, hemoglobin estimation. Number 2, blood grouping. Okay, to rule out erythropoiesis fetalis ke chances. That's why RH grouping is also important. So blood grouping is not only A, B, AB and O. Is it positive or negative? A positive, A negative, B positive. So positive, negative is more important. I'm sure that you are aware about the erythroblastosis fetalis. If the mother is negative and the father is positive, there can be a chance the baby is having erythropoiesis fetalis. Yes or no? So maybe it's A positive, A negative, B negative, O negative or AB negative. Doesn't matter. But the mother is negative and the father of the baby is positive. So blood group checking of the mother. If the mother is negative, then only we will call the father and do the blood grouping of the father. If the mother is positive for any blood group, we will not check the blood group of the father. We will check the blood group only if the blood group of the mother is negative. So that's why here RH factor is mentioned. I hope you are getting the relevance out of that. Then we will do, the syphilis, hepatitis B and HIV screening. Okay, screening for the syphilis, HIV and hepatitis B. All the STDs we will rule out. Okay, then we will do the test for malaria only in endemic area. RDK test, rapid diagnostic kit test for the malaria. Okay, like pregnancy kit, malaria kit is also there, and urine examination. So these all investigations we are going to do in the first visit. You should enumerate. So first hemoglobin, then blood group, then all STDs. STDs में HIV, syphilis, hepatitis B we are going to rule out. Hepatitis B may be STD, matlab sexual, but mostly it is due to percutaneous route. Malaria and urine routine examination. So these are the investigation must done in all pregnant ladies on the first visit. After that, you have to do general counseling. You have to counsel that do only institutional delivery. Don't do home delivery. Don't even think of home delivery. Promote institutional delivery in the first visit only. So that she can make a mindset during the gestational period that at the time of labor, I have to run to some nearest healthcare service. I don't have to do home delivery with the help of DAI. Complications are more in home delivery as compared to institutional delivery. In the institutional delivery, we can manage, even the complicated deliveries, complicated labors and deliveries, but at home, it's not possible. At home, only uncomplicated deliveries can be managed by the DAI. That's why we have to promote institutional delivery. To promote institutional delivery, the government has made many schemes like Janani Suraksha Yojana, Janani Shishu Suraksha Karikram, Janani Shishu Suraksha Karikram, Janani Suraksha Yojana. I'm going to teach you all these when I'm going to teach you the national health programs. Okay, but these are the various incentives the government is going to give to the pregnant ladies if they are going to do the institutional delivery. Just to promote institutional delivery, government is giving cash incentives to them. How much incentive each delivery is given, I will teach you under these programs. So you have to first promote institutional delivery, then you have to give, you have to tell them about these programs so that they get tempted from day one only that I have to do institutional delivery. Double faida. It is safe also and I will get incentives also. So you have to, tell them about these yojanas and schemes which are running by the government. Okay, and you have to identify the nearest PSC. If it is a sub center, you should inform the lady that at the time of the labor pain, you have to run to the nearest PSC, and you have to identify if it is a high risk pregnancy. High risk pregnancy care is given in a different way. Okay, got it? High risk pregnancy care is given in different way. Got it? Can we go ahead? So this is in the first visit. You should know must do. You should know the 5 investigations, 4 in blood and 1 in urine, and you should know what to counsel. Mainly you have to do counseling regarding the institutional delivery. For that, you have to tell regarding the various yojanas and all. That's it. Now, remaining all visits. In remaining all visits, the same thing. You have to do the physical examination and abdominal palpitation in every visit so that you can know about the fetal growth, whether the fetal growth is with gestational period or it is lagging. So you have to do the abdominal palpitation to see the fetal life, fetal growth, fetal heart sound, and you have to do the fetal examination, physical examination. After that, at every visit, hemoglobin should be done. Hemoglobin estimation, minimum 4 visits, 4-time hemoglobin estimation should be done. Urine routine examination, or urine should be seen for microorganism, sugar and protein. And at 24 to 28 week of gestation, all pregnancies should be done the oral glucose tolerance test, oral glucose challenge test, oral glucose challenge test, OGCT. This test has to be done, especially during the second or third visit, 24 to 28 week. This test, how it is done, I will let you know. To rule out the gestational diabetes mellitus. You know, some pregnant ladies develop diabetes during pregnancy. They don't have diabetes before pregnancy. They were normal. But during pregnancy, it's common. The ladies can have diabetes. So it is gestational diabetes mellitus. We have to control the diabetes. Otherwise, the size of the fetus will be very large. You know, various complications can happen to the fetus. So controlling this gestational diabetes mellitus is important. But how we come to know the lady is having gestational diabetes mellitus? We have to do the test. Especially 24 to 28 week. The name of the test is oral glucose challenge test. So we have to do this test at the second or third visit. And what we have to counsel during other visit? During other visit, we have to counsel adequate rest, adequate nutrition, balanced diet during the pregnancy. I will let you know how much extra she should eat, recognition of the danger sign during the pregnancy, if there is vaginal bleeding any time during the pregnancy, initiation of breastfeeding immediately after birth. We will counsel beforehand only, because just after the delivery, we don't get a chance. So we will counsel as soon as you will get delivered, you start breastfeeding to your baby. We will counsel during the visits only, antenatal visits, counseling for a small family norm. We will do the counseling that this is already your second child. Now don't go for the third child. It's too, you know, this norm we are promoting in India. Use of contraception after the delivery. Okay. And all these counseling we are going to do in the subsequent visits. So you should know what we are going to do in the first visit. Being a doctor, what's our responsibility for the subsequent visit? You should know how many antenatal visits are required. So till now, I taught you the definition of antenatal care. So I'm teaching you antenatal care. After that, I will teach you intranatal, then postnatal. Currently, I'm teaching you antenatal care. I already taught you the definition. It is the care given during pregnancy. That is from the point of conception to the onset of labor. During entire pregnancy, we are giving this care to the pregnant ladies. There are 4 objectives. You should learn the objectives. Ideally, there should be 14 visits. But in India, we recommend 4 visits. And you know when 14 visits, you know when 4 visits. And WHO recommend 8 visits. Vivek, you don't have to learn ki those 8s when, but these 4 you have to learn. These 4 visits when should be conducted, and these 14 when should be conducted. Now you should know the protocol, what things you are going to do in the first visit. Okay, must do things along with investigation, and what things you are going to do in the subsequent visits. People, give me a thumbs up. Now tell me the preventive services we are offering in all these, in the first visit as well as subsequent visit. What preventive services we are offering to the pregnant ladies free of cost at all PSCs, CSCs, sub-centers. We are providing these services free. The pregnant lady don't have to pay even a single penny, single money for these services. ANC care is given free of cost. Okay, because the poor pregnant ladies have the same right as that of the people who have the money, okay, having the care. ANC care is given free of cost. So what all services we are providing, I mean the Government of India is providing free of cost to the pregnant ladies, these 7 services. These are antenatal services which are providing free of cost at all PSCs, CSCs and sub-centers. First of all, the lab investigations. Lab investigation at sub-center, lab investigations at PSC. You know, at sub-center, only these investigations are available. First of all, UPT kit is available free of cost. The name of this UPT kit is Nishchay. I told you, na, Nishchay. It's a UPT, urine pregnancy kit. Okay, so as soon as during the first time when the lady is coming and saying, I think I am having doubt that I am pregnant. Doctor, I am having doubt. So give this kit to the lady and ask her for confirmation. Okay, by putting few drops of her urine here. Maybe the morning first sample urine or any urine can be put. It is not necessary the first. The first urine is concentrated, so results are more reliable. So this kit should be provided free of cost to the lady so that she can do the confirmation. After that, malaria confirmation, RDT. With RDT, hemoglobin estimation via Sahil's hemoglobinometer. Okay, we don't have the counters at sub-center. You know, we are having simple SALIs, Sally's hemoglobinometer. I guess everyone know what is Sally's hemoglobinometer. We are having the urine strips. Have you seen the urine strips? Okay, for the protein and sugar estimation. And HIV. HIV is proposed. It is not yet present at subcenter. These are the investigations present at the subcenter, and they are done free of cost on the first visit, as I told you. Now, what investigations are at PHC or CHC or first referral unit? FIU is first referral unit. I will teach you the chapter Healthcare of the Community, in which I will tell you everything about the subcenter, PHC, CHC, first referral unit, second referral unit, the staff at that. I will teach you everything when I will teach you the chapter Healthcare of the Community. Currently, I guess everyone know the chronology. Now, first of all, there is a subcenter. First of all, there is Village Health Guide, the lowest. After that, there is subcenter. Then there is PHC. Then there is CHC. Okay. Then there is after CHC, there is hospitals, referring hospitals, and then there's tertiary hospitals, medical colleges, the tertiary medical colleges or hospitals. So this is the complete chronology, you know. So I told you the tests which are done at subcenter. Now I will tell you the tests which are done at PHC or CHC. At PHC or CHC, we do blood grouping. We do VDRL test for syphilis, HIV test, HBS antigen test for hepatitis B, and random blood sugar. These tests are done at PSC. So you should know which tests are done at subcenter and which tests are done at higher centers. And these tests are done free of cost. Which tests are done during first visit, and out of them, which of them are done during the subsequent visit. Okay. So if the lady is coming at subcenter, do the tests which are available at the subcenter and ask her to go to the PSC for doing further tests. And these all tests will be given free of cost. After that, Iron-Folic Acid supplementation. It is known as IFA. Absolutely right. Iron-Folic Acid supplementation. IFA. So all the pregnant ladies given these tablets free of cost. These tablets contain iron as well as folic acid. How much iron? How much folic acid? Each tablet contain 60 milligram iron, and each tablet contain 500 microgram folic acid. Okay, just a second. I'm sorry, 60 milligram iron and 500 microgram folic acid. 60 milligram iron and 500 microgram folic acid. This is the constitution of one tablet. One tablet, you learn it, it's an MCQ. 60 milligram, it's milligram, it's microgram. 60 and 500, one tablet. Each one tablet contain. These are blue color tablets as seen. Okay, from when they are started? They are started from day one of the 14th week. I'm sorry. They are started from 14th week onwards. 14th week onwards till 6 months even after the delivery. Okay, so total 1 year. Roughly 1 year it is given free of cost. But we start from the 14th week. If the hemoglobin is more than 11, we give one tablet daily. But if the female is anemic, the cutoff for pregnancy is 11. The cutoff for pregnancy is 11. I guess you know that, 11 gram hemoglobin. If the hemoglobin is less than 11 gram per deciliter, the female is anemic during pregnancy, which is very common in India. So give 2 tablets daily. So how much this tablet has to be given? So I'm talking about Iron-Folic Acid supplementation. Iron-Folic Acid tablets. They are blue color tablet. Each tablet contain 60 milligram iron and 500 microgram folic acid. This is the composition of each tablet. If the hemoglobin is more than 11, give one tablet one day. If it is less than 11, give 2 tablets one day. And when to start? Start from 16th week of pregnancy till delivery, till 6 months even after delivery. So total 1 year. Give this tablet free of cost. How many of you got it? So this all is done by the Govt of India for antenatal care. It is done free of cost. The next is tetanus immunization, tetanus vaccine. All the pregnant ladies should get 2 doses of tetanus vaccine 1 month apart. The 2 doses are given 4 weeks apart, or roughly 1 month apart, or 4 weeks apart. The first dose should be given after 3rd month, after first trimester, anytime. As soon as first trimester is crossed, give the first dose. And second dose 1 month after that. 1 month after that. So if the next pregnancy is within 5 years, then 2 doses are not required. Okay, only 1 booster is required. If the next pregnancy is after 5 years, again two doses are required. How many of you got it? So if the next pregnancy is less than 5 years, then in the next subsequent pregnancy, only booster is required. Okay, no mother should be denied of this vaccine. All pregnant ladies should get this vaccine. Now imagine the lady is coming directly at the time of labor to me. Okay, the lady is not coming during. So I asked, why didn't you come for any of the visit? Okay, minimum you should come at least for 4 visits. So she said ki no, in villages there are many excuses, many taboos, and many religious causes can be there. So she has not come during the entire antenatal visit. So how I will give the tetanus vaccine to her? So at the time of the labor only I will give the first dose. At least 1 dose has to be given. No mother should be denied of this vaccine, even if she is coming off the late antenatal visit, late pregnancy. Even that, give 2 doses if possible. Okay, if not, give at least 1 dose. Give at least 1 dose. Got it? Now do the deworming. What is deworming? Worms are also common. Worms in the intestine, regarding the parasites present in the intestine, in the microbiology. Yes or no? So mebendazole is a drug of choice for deworming in pregnancy. Don't give albendazole. Albendazole is contraindicated. Give mebendazole. Give mebendazole. 1 single dose. Okay, it should be given to all the pregnant ladies free of cost. 1 single dose, not daily. 1 single dose. That's it. Okay, deworming. So if worms are present, deworming will be done. Otherwise, anemia, some worms, the hookworms, Necator americanus and the hookworms, they hook in the intestine and they cause bleeding from the intestine. So anemia can be exaggerated during pregnancy. So deworming is necessary to prevent anemia. It's a prevention to prevent the anemia during pregnancy. So we are doing deworming. We are not sure whether the worms are present or not present in the intestine, but we are giving prophylactically. There is no harm giving prophylactically. It's 5 years. It's 5 years, not 3 years. 5 years. Within 5 years. Got it? Got it? Mustarif. Okay. Now, the next is calcium. Calcium tablets are also given to the pregnant lady. Okay, twice a day, two times a day. A total dose of 1 gram. So you give 2 tablets, 500 milligram. 500 milligram, 1 in the morning, 1 in the night. Total 2 tablets a day. Total dose is 1 gram. That is 1000 milligram. That is the calcium dosing. It is given free of cost. It is also started 14 week along with IFA. It is also started and given 6 months postpartum. So total 365 days approximately. So total we are starting 2 type of tablets, IFA tablet and calcium tablet. We are giving both the tablets free of cost to the pregnant lady. IFA tablet contains 60 milligram iron plus 500 microgram of folic acid. This one tablet contains 500 milligram of calcium. Okay. This is iron, this is folic acid, this is calcium. What is the dosing? What is the dosing? This tablet has to be given OD if hemoglobin is more than 11, BD if hemoglobin is less than 11. This is always given BD. It is not related to hemoglobin. The calcium is always given BD. So total dose is 1 gram per day. Okay, and when to start? Both of them are started from 16th week of pregnancy till 6 month postpartum. People say, got it or didn't got it? Got it? Got it or didn't got it? Okay. Can we go ahead? Okay. Now the next is referral services. Referral services ke liye on the MCP card, which you have already filled on the first visit. MCP card is Mother Child Protection Card. Mother Child Protection Card. MCP card. In Hindi it is known as Matra Bal Suraksha Card. Okay. MCP card should be made for all pregnant ladies at the sub-center. Okay, so first, in the first visit, when the lady is coming to you, first you examine, take proper history, do the investigation, based on which you decide, is it a normal pregnancy or high risk pregnancy? If it is a normal pregnancy, make green card. If it is a high risk pregnancy, make the red card. So card ka color is different. So if it is a red card, it has to be referred further to the higher centers. From the sub center, it will be referred to PHC. From the PHC, it will be referred to CHC. From the CHC, it will be referred to the regional district hospitals. And from there, it will be referred to the tertiary medical colleges. Like that, referral services will be there with a red card. Green card will be dealt there only. So this is how the referral services are provided. So this is all provided free of cost to all pregnant ladies. This is known as antenatal care package provided to the ladies. How many of you got it? So I taught you the antenatal package. I taught you the 7 services which we are providing free of cost to all the pregnant ladies in India. Now supplementation in pregnancy. Okay, supplementation in pregnancy. What the pregnant lady should eat? I told you now, counsel her about the diet. She's asking you, you are a doctor, and she's asking you to prevent the osteoporosis. Generalized, we give the calcium because in the fetus also bone formation will take place. So calcium requirements are increased during pregnancy. That's why we are giving the calcium. In India, it is not fulfilled with the diet. That's why. Okay, now supplementation. So what the lady should eat during pregnancy? How much she should eat extra? I already taught you in the chapter nutrition. Here quickly we will revise the supplementation. So supplementation during pregnancy. So if the lady is asking you, doctor, normally I eat this much. How much extra should I eat now? During the first trimester, how much should extra? During the second trimester, during the third trimester. So how much extra should I eat during pregnancy? That is a valid question asked by the pregnant lady to the doctor, to the healthcare provider. Being a doctor, you should know your specific answers. Okay. So this is the calorie requirement. This is the calorie requirement. First, you see the calorie requirement even without pregnancy. Without pregnancy. So ask the lady, are you a sedentary worker, moderate worker, or intense worker? How much activity you do in a day? Okay. Even after pregnancy, how much active you will be? Okay, are you a sedentary worker? You just sit on a chair, or are you a moderate worker? You do household work, or you are an intense worker? You are a labor or any intense worker. Okay, so what type of activity you are going to perform in the gestational period ahead? What type of activity you perform regularly? So if she is saying sedentary, moderate, or heavy, there are three categories. Okay, so for sedentary female, it's 1600 kilocalories per day. For moderate, it's 2100 kilocalories per day. And for heavy, it's 2700 kilocalories per day. Learn the first two digits. It's 1600, 2100, 2700. I already taught you in nutrition. So first you see, this is the normal. This is 1600 kilocalorie per day, 2100 kilocalorie per day, and 2700 kilocalorie per day. This much kilocalorie per day that female requires. That females without pregnancy, this much calories are required. Okay, now if she become pregnant, additional 350 is required. Additional 350. So additional 350 here, additional 350 here, additional 350 here. Whatever is the answer in all three trimesters. Additional 350 kilocalories is required. Okay, additional. You just add whatever is the answer, add whatever is the answer, add whatever is the answer. Got it? During lactation, she require even more, because during lactation, she has to feed her baby also. So she has to eat double, okay, she has to feed her baby also. So during the first 6 months of gestation, lactation, she has to take additional 600 calories. And after 6 months of lactation, she has to take additional 520 calories. Because after 6 months, weaning is started. We give extra food, outside food also, apart from breastfeed, outside food also to the baby. So breastfeed demand will decrease. So this is what we give. People say, got it? Say. So you can see this is the calorie requirement. So what is the calorie requirement? Tell me the calorie requirement. So this is a summary. The calorie requirement during pregnancy is additional 350 kilocalories per day in all trimesters. So if the lady is asking, doctor, I eat this much. So you ask, whatever you are eating, it's good, but you eat additional 350 kilocalorie throughout your pregnancy. So that should be the valid, justifiable answer, scientific answer. Okay, evidence-based answer. So you should say the lady that you should eat additional 350 kilocalories, whatever you are eating, additional to that throughout your pregnancy. So depending how much you are eating, it depends on your sedentary worker, moderate worker, or intense worker. If you are a sedentary worker, you should eat 1600 kilocalorie per day. If you are a moderate worker, you should eat 2100 kilocalorie per day. If you're an intense worker, you should eat 2700 kilocalorie per day. Additionally, you should add 350 kilocalorie. And during breastfeeding, when you do the breastfeeding, you should eat additional 600 kilocalorie. Okay, during the first 6 months, and additional 520 kilocalorie during the next, after 6 months onwards. Say, got it? Got it? Say, got it or didn't got it? So you can see this is lactation. This is the calorie requirement during lactation, pregnancy and lactation. What is the protein requirement? What is the normal protein requirement? All male, healthy male should eat 54 gram of protein in one day. Okay, all females should eat 46. Currently, I'm not interested in male. I'm interested in female. Okay, because I'm teaching you the topic obstetrics, pregnancy in female. Okay, this I already taught you in the chapter nutrition. So all the females should eat 46 gram of protein per day. Yes or not? During pregnancy, during the first trimester, no additional protein is required. Okay, organogenesis starts from the second and third trimester. In second trimester, additional 9.5. So add 9.5 in the 46. In the third trimester, add 22. So 46 plus 22, whatever is the answer. During lactation, additional 17 in the first 6 months and additional 13 6 months onwards. How many of you got it? So this is the protein requirement. How many of you got it, people? How many of you got it? So tell me, pregnancy ka nutrition. Pregnancy mein energy requirement. Okay. And pregnancy mein protein requirement. Say, energy requirement is always 300 kilocalorie. I'm sorry. It is additional. Okay, 350 kilocalorie, not 300. Okay, and protein requirement is plus 9.5 or plus 22. Lactation you learn separately. Okay, so I taught you the protein requirement. Now what about the calcium requirement, iron requirement, vitamin A requirement? Vivek, you can see here. So calcium requirement during pregnancy is 1200 milligram per day. Okay, iron requirement is 35 milligram per day, and vitamin A requirement is 800 microgram per day. So all requirements are increasing during pregnancy. Basically, you should learn the energy and the protein requirement. The energy requirement during pregnancy and protein requirement during pregnancy. Energy requirement is additional 350 kilocalories per day. Protein requirement differs from trimester to trimester. In the first trimester, nothing additional, it's 46. In the second, 46 plus 9.5. In the third, 46 plus 22. This is the requirement. How many of you got it? And during lactation also, you should know. Say, shall I say the summary or you got it? Everyone got it. Can you help me during pregnancy and lactation? Let's divide pregnancy, lactation. So tell me the energy requirement during pregnancy and lactation and protein requirement, energy and lactation. So here it depends whether the worker is sedentary or moderate or intense. Okay, so pregnancy may energy requirement is additional 350 kilocalories per day. Okay, during lactation, during the first 6 months of lactation and 6 months onwards. First 6 months and 6 months onwards. First 6 months, it's additional 600 and later on, it's 520. So this is energy requirement. What about the protein requirement? Protein requirement is 46. Normally it's 46. Okay. Now first, second, third. First में 46 plus 0. Second में 46 plus 9.5. Third में 46 plus 22. Lactation में again 0 to 6 month, more than 6 month. 0 to 6 month में plus 17 and more than में plus 13. Am I right? Yes or no? So this is the complete requirement in front of you. Okay. Now the next is weight height product index, WHPI. What is this index? Weight height product index. So you should calculate this index for the pregnant ladies. Okay. First see the weight, current weight and current height of the pregnant lady. See the current weight of the pregnant lady, current height of the pregnant lady. Okay. So current weight into current height upon expected weight at that gestational period and expected height at that gestational period into 100. So this ratio is known as WHPI, weight height product index. Okay, so what is the current weight, current height, and what should be the expected weight and expected height at this gestational period? So current weight into current height upon expected weight into expected height into 100. This ratio is WHPI. It should never be less than 100. If it is less than 100, it is indicating malnutrition during pregnancy. So I taught you everything regarding the supplementation during pregnancy. In supplementation during pregnancy, you know the extra energy requirement, you know the extra protein requirement, you know about the index, weight, height, product index, you know how to judge the malnutrition during pregnancy. So that's regarding the supplementation in pregnancy. Now the next thing here is GDC, gestational diabetes screening. Gestational diabetes mellitus screening. You know what is GDM? GDM is gestational diabetes mellitus. Gestational diabetes mellitus means the diabetes during pregnancy. Before pregnancy, the lady was normal, healthy. She was not having diabetes, but she developed diabetes mellitus during pregnancy. So it is known as gestational diabetes mellitus. How to rule it out? How to do? There is a test. We are doing a test. So we are doing the test in the pregnant lady. There is a pregnant lady. We will give 75 gram of glucose. We will give 75 gram of glucose in water. 75 gram, learn 75 gram of glucose and ask her to drink. And after that, nothing. After that, do not eat or drink anything. And just after 2 hours of that, okay, we will measure plasma glucose, PG. We will measure PG, plasma glucose. We will measure PG. So if PG is more than 140 or less than 140 here. Okay, there are two options. It is more than 140, less than 140. If it is more than 140, the test is negative. The lady is not having GDM. If it is more than 140, the test is positive. Are you getting it? If it is less than 140, the test is negative. Okay, the test is negative. If it is more than 140, the test is positive. You have to start the treatment. But if it is less than 140, you have to repeat the test. You have done it on the first visit, then repeat it at 24 to 28. If it still is negative, okay, it's negative only. But if it is positive the second time, you can start the treatment. So you have to do the same test 2 times. So you have to learn this test. Okay, this is known as oral glucose challenge test, OGCT. It is done to rule out GDM, gestational diabetes mellitus. So the name of this test is oral glucose challenge test. It is done to rule out the GDM. So what we are doing, we are giving 75 gram of glucose to the lady, and just after 2 hours of that, we are measuring the plasma glucose. Plasma glucose is less than 140, the test is negative. It is more than 140, the test is positive. If the test is positive, we start the lady on insulin. Okay, oral hypoglycemics are contraindicated. They are contraindicated. Okay. Yes, she should be fasting, Sumarna. There should be 8-hour fasting before that. 8 hours of fasting is required. And after that, 75 gram of glucose is given. Okay, minimum 8-hour fasting is required. Nice question. Got it? So this is the test. Now tell me, at-risk mother. I told you, no, you have to identify the at-risk, high-risk pregnancy. I told you, no, you have to identify the high-risk pregnancy. And if it is high-risk pregnancy, you have to make the red MCH card. And you have to refer it to the PSC and higher referral units. Yes or no? So how to identify? You must ask me, ma'am, which pregnancy is high risk? How I will know, being a doctor, that this pregnancy is high risk pregnancy? These 11 pregnancies are high risk pregnancy. You have to learn the number. These 11 pregnancies are high risk pregnancy. If during pregnancy, the pregnant lady is having pre-pregnancy weight, before pregnancy, she is having weight less than 45 kg. Before pregnancy, she is very lean and thin. Her weight is less than 45 kg. Her weight, you know, the reference Indian female weight is 50 kg. She is even less than that. Her pre-pregnancy weight is less than 45. And now if she become pregnant, it's a high risk pregnancy. Okay. If her height is less than 145 centimeters, she is too short. Her height is less than 145 centimeters. You have to learn these cutoff for your MCQs, people. You have to learn these cutoff. Okay, so if the weight is less than 45, if the height is less than 145, if there is severe anemia during pregnancy, if there is severe anemia, if there is a twin pregnancy, all twin pregnancies are high risk pregnancy. Twin pregnancy means high risk pregnancy. If there is a previous pregnancy, may cesarean section is done. Okay, if there is any systemic disease, if before pregnancy she is having any systemic disease, maybe having diabetes, maybe hypertension, any systemic disease. Okay, maybe she is more than 35 years of age and now she become first time pregnant. First time, elderly, prima, more than 35. She is more than 35 years of age and she is prima. First time she got pregnant, so it's a high risk pregnancy. Maybe she is more than 35 years of age and you know, it is not prima, it is the multipara, multiple times. So both more than 35 years pregnancy, maybe first time, maybe subsequent time, it's a high risk pregnancy. Pregnancy at more than 35 years of age of female, it's a high risk pregnancy. It's a high risk pregnancy. Okay, grand multipara, more than 4. Okay, she already was pregnant 4 times before. Whatever is the fate of that pregnancy, that doesn't matter. But she is pregnant 4 times before this pregnancy. Okay, maybe this is the 5th, 6th or 7th pregnancy. So this pregnancy is high risk. Eclampsia during pregnancy, you know, hypertension, eclampsia or antepartum hemorrhage. Anytime there is bleeding, vaginal bleeding during pregnancy. During the pregnancy, bleeding should not be there. Vaginal bleeding. If there is a vaginal bleeding at any time, it is APH and it's a high risk pregnancy. So all these pregnancy are labeled as high risk pregnancy. You have to learn this list. Either you learn today or you will learn in the obstetrics when you will be in final year. This is high risk pregnancy. High risk pregnancy. You have to learn this list. We are done with antenatal care. If you are getting a question, long question on antenatal care, you have to describe your answer under these headings. We are done. You should describe the definition, the objectives. The ideal visits are 14. Minimum visits recommended by Govt of India are 4. Okay, you should know the protocol. What investigations at first visit? What investigation at subsequent visit? You should know the 7 services which are providing free of cost to all pregnant ladies. You should know the supplementation. In the supplementation, you should know the energy requirement. You should know the protein requirement. You should know how GDM screening is done. And you should know the 11 high risk pregnancies. Give me a thumbs up, people. Everyone give me a thumbs up. Okay, got it? What you are asking, previous LSCS can have normal delivery next time or only LSCS is needed? No, it's the obstetric question, Vivek. There are various factors deciding that. If it is previous LSCS, ideally that all pregnancies next subsequent should be LSCS only. Normal pregnancy should not be tried because of the risk of the scar rupture. Ideally, okay, but practically sometime we can try, we can give a trial under safe environment. At any time we can convert into LSCS, but ideally it should not be tried. Okay, chalo. So we are done. I'm having some questions for you. Are you interested for the questions? Read the first question, tell me the answer. But I'm not launching the poll. Write the answer in the comment box. Fast. Minimum antenatal visits. Minimum antenatal visits as per Govt of India. What's the correct answer? Be fast. Yes, obviously it's 4. You should know when. At which week of gestation, the minimum 4 are required. And ideally there are 14. The extra energy requirement per day during pregnancy. Extra energy requirement per day during pregnancy. Extra 150, extra 200, extra 300 or extra 350. Yes, obviously you all are right. It's extra 350 kilocalories per day. Okay. Now, recommended dose of folic acid during pregnancy. How much folic acid is required during pregnancy? Folic acid, recommended dose of folic acid during pregnancy. So, iron folic acid tablet contain how much folic acid? It contains 60 milligram of iron and 500 microgram of folic acid. So, the correct answer is 500 microgram of folic acid. We are done with antenatal care. Okay, I hope all MCQs can be cracked. You can solve from whatever source you are following. Coming on the intranatal care. Can I come on the intranatal care? Give me a thumbs up. Let's start the intranatal care quickly. What is intranatal care? As seen in the image, it is the care given at the time of delivery. At the time of delivery. So it starts with the onset of labor and it ends with the delivery. It starts with the onset of labor and it will end with the delivery. Okay, so from labor till delivery, the end of delivery, the care is known as intranatal. During delivery, the care during delivery. So here only 3 things have to be learned. Here only 3 things have to be learned. The 5 cleans of safe delivery, suggested 7 cleans. Okay, currently we are following 5 cleans. But you know, the Government of India is suggesting 7, but we have not yet launched the 7 cleans. And the contents of DDK, disposable delivery kit, the contents of DDK. Okay, first the 5 cleans. What are the 5 cleans of safe delivery? We are recommending, the Government of India recommend 5 cleans for a safe delivery to prevent the neonatal tetanus. Okay, what are the 5 cleans? These are the 5 cleans. Okay, the delivery surface should be clean. Okay, the delivery surface should be clean on which the pregnant lady will lie and she will deliver. She will deliver that surface. So every time a new plastic sheet, a new clean, sterile plastic sheet should be used every time with every labor, with every delivery. In a government hospital, in PSC, one after another, many deliveries takes place in one day. So it is not on the same stretcher, on the same bed, not stretcher, on the same bed all the ladies are taken. No. So sheet, on the same bed they will be taken, but the sheet should be changed with every delivery. The clean surface, it should be with clean plastic sheet. Okay, and it is disposable. Once the delivery is done, the lady is shifted to the ward from the labor room. This is a bed in the labor room. So the lady is shifted. After that, the sheet is changed before taking the next delivery. Okay, clean hands of the attendant. Okay, clean hands of the attendant, not of the lady, the attendant, whosoever is the attendant. Maybe the attendant is Dai, maybe it is a doctor, maybe it's a nurse, whosoever is the birth attendant. The hands should be clean. It should be washed with the soap and clean water before assisting the delivery. After that, clean cord cut. Once the baby will be out, the cord has to be, the umbilical cord has to be cut. The mother and baby has to be separated. So that should be cut with a new razor, sterile razor blade. New razor, sterile blade every time. It should be a new blade. It should not be any used. Okay, otherwise the newborn can have tetanus. The next should be tie. You will tie the cord now with a thread or something. That thread should be sterile. That thread should be new, sterile. And cord stump. On the cord stump, can you see this is stump? This is cord stump, umbilical cord stump. Nothing should be applied. Now there are various religious taboo in various religions. Some people apply honey on that. I have seen. Okay, some people apply cow dung, cow dung on that. They consider cow dung is very pure. And, the umbilical cord of the baby should be started with honey, should be started with cow dung. These all taboos are there. Nothing should be applied. Otherwise, that will contaminate the blood, that will contaminate the cord. And the neonatal tetanus chances are very high. So these are the 5 cleans. People, what are the 5 cleans? At the time of the delivery, we should make sure. We are doctors, we should make sure about the 5 cleans. As soon as I am taking any delivery in the labor room, in a PSC, I am a doctor and there is a lady in labor in the PSC. So I have to conduct that delivery. I am a doctor, I will conduct. I am the medical officer there. So first of all, I will change the sheet. Make sure the lady is lying on a bed in the labor room which is having clean surface. Number 1, I will wash my hands with soap and water. Okay, I will make sure my hands are clean. So clean surface, clean hands. Once delivery is done, whether normal, whether cesarean section, the cord between the baby and mother has to be cut with a new sterile razor blade. I will make sure. And I will tie the stump of the baby, with a clean thread. And nothing has to be applied on the cord, on the umbilical cord. So these are the 5 clean. Clean surface, clean hand, clean cut, clean tie, clean stump. Say again. Say again. Say, ma'am, clean surface. The first is surface. Clean surface, clean hands, clean cut, clean cut with the blade, clean tie with the thread, and clean cord. Okay, clean cut, clean tie, clean cord, clean surface, clean hands. And how you are making sure? You should know that. Say people, got it? Now, the Government of India is suggesting 7 cleans. These 5 are already there. We will add 2 more. These 5 are already there. We will add 2 more. There should be clean water and clean towel. You said, now the birth attendant should wash the hand. After washing the hand, there should be clean water, no? There should be clean water with which the hand should be. So soap is there. But what about the water? Okay. And after water, after washing, there should be clean towel with which it should be, you know, it should be wiped. It should be wiped. If there is no clean towel and if after washing thoroughly, how I will wipe it? So with some dirty cloth, if I am wiping, there is no use of washing. So clean towels, clean water and clean towels. So currently we are recommending 7 cleans. You know, so currently following 5 cleans, but recommending 7. Okay, these are the 7 cleans. The 5 are already there. 2 we have added. So total 7 cleans are there. Tell me the 5 cleans, people. The 5 cleans of the delivery. Say 5 cleans of the delivery. Clean, 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 clean. Say clean surface. Okay, clean hands of the birth attendant. Clean cut, clean tie, clean cord. And we are adding 2 more here. Okay, clean water and clean towel. Clean towel. Yes, you have to learn. So we are recommending 7, but currently there are 5. So there is a kit which is known as disposable delivery kit. With every delivery, we should open it. A new kit should be opened. It contains the 5 cleans. It contains the 5 cleans, not 7. It contains the 5 cleans. It is known as DDK. Disposable delivery kit. Okay, so what does it contain? It contains gauze piece. Say, if I open this kit, it contains gauze piece inside that. It contains 2 ligatures. Okay, suppose one is wasted, so there are 2 ligatures for the clean tie. It contains a new sterile razor blade for the clean cut. It contains soap, one soap, okay, for clean hands. Okay, it contains antiseptic lotion. Okay, after use soap, the antiseptic lotion can also be applied on the hands, and it contains cotton. Okay, so out of the 5 cleans, 3 of them are fulfilled here. The clean tie, clean cord, and clean hands is fulfilled here. Apart from that, it contains the gauze piece and the cotton. So it contains the thread, razor, soap. It contains antiseptic solution, cotton, and gauze piece. So this is the components of DDK. How many of you got it? We are done with intranatal care. If intranatal care is given in your question, basically you have to focus on the 5 cleans. That's it. 5 clean and 7 clean. You can say 5 clean or 7 clean and the components of DDK. We are done. Okay, read the question, tell me the answer. Fatafat. After washing the hands, Sumanna, the lotions can be applied on the birth attendant hands. Okay, which of the following is not included in the 5 cleans? Which of the following is not included in the 5 cleans? Clean hands, it's included. Clean surface, it included. Okay, clean cut of the cord, it's included. But clean perineum is not included. Okay, it is not any of the 5 cleans. So I guess you know. So we are done with intranatal care. If you are getting a long question, you are prepared. In antenatal care, usually you get short question because it's short, only 5 cleans is there, nothing else. Now coming on the postnatal care. Let's come on the postnatal care. Finally, let's come on the postnatal care. Postnatal care, I'm going to discuss under these headings. What is postnatal care? Tell me the definition. What is postnatal care? It is the care given to the mother after the delivery of the baby till 42 days. After the delivery of the baby till 42 days. Puerperium, this period is known as puerperium. So it ensures the well-being of mother as well as baby. Because just after delivery, our job is not ending. The delivery is done, so obstetric care is over now. No, even after delivery, we give the obstetric care. Essential obstetric care continues even after delivery till 42 days of delivery. So that is postnatal care. Postnatal care. How many visits? Minimum postnatal visits. So this lady should go to the doctor to meet the doctor after delivery. How many times? Minimum, again 4. Okay, like antenatal visits, the minimum postnatal visits are also 4. Recommended by Government of India. The 4 postnatal visits. The first visit should be on day 1 of the delivery. Okay, if it is a home delivery. If it is institutional, obviously the first date will be done. The second will be on 3rd day. Okay, the 3rd visit is on 7th day of the delivery. And the last is on 6 weeks after delivery. So this lady, if suppose this lady is doing home delivery. If she is doing home delivery. So on day 1, lady cannot go, but Asha can come to visit here. Okay, so that will be first visit. First visit in case of home delivery. If it is institutional delivery, automatically the doctor will visit it. Okay, the second visit is on third day. The third visit is on seventh day. And fourth visit is on 6 weeks after the delivery. So you should learn when is the 4 visits. So minimum postnatal visits is 4. So the lady is coming along with the baby to visit the doctor 4 times. Minimum visits are 4. When? On day 1, first day of delivery, third day of delivery, 7th day of delivery, and 6 weeks after the delivery. Okay, this is postnatal visits. Postnatal visits. Okay, all the visits, if home visits are there, if lady is not coming to the doctor, okay, the medical officer, I will send the female health worker to the home of the lady. I will not go. I will send the female health worker from my PHC, from my sub center to the home of the delivery, to the home of that lady which delivered home delivery only. Okay, to do the 4 visits. If the lady is not coming, we will go to the lady to examine her. What are the elements? What we are going to do? So 2 main elements are there to ensure the breastfeeding is started. To ensure, because suppose she is priming, she become pregnant first time, so she is not sure about the breastfeeding, she don't know about that. Maybe some elders, the grandmothers or some dais will guide her about that, but maybe she is not having anyone to guide at her home. So it's the responsibility of the doctor to guide her regarding the breastfeeding, okay, especially to the primas. Okay, so breastfeeding, to ensure that breastfeeding should be started within 1 hour of the birth. Within 1 hour of the birth, the breastfeeding should be started if it's a home delivery. Okay, number 1. And number 2, regarding the nutrition, hygiene, now further contraception and essential newborn care and immunization of the newborn. So immunization of the newborn care. Now follow the contraception so that you don't become pregnant at least for the next 3 years, so that your body can recover before the next pregnancy. And if it is already small family norm, the 2 children are already there, we promote the sterilization. So we will send female health worker to the home of this lady who just delivered. We just send the female health worker 4 times to do these 2 jobs. This is the element to ensure breastfeeding is. So I'm a doctor at my PHC. Okay, so I will send the female health worker to the home of this lady, and female health worker will make sure that the breastfeeding is started, proper immunization is done of the nutrition, hygiene, contraceptive, and she will report at the PHC that everything is done. So this is the care we are providing. Okay, now what all services we are providing to the mother and what all services we are providing to the newborn in postnatal care. Tell me the exact services. Tell me the services provided to the mother. So this female health worker, she is going to the home of the mother after delivery and asking, do you have any heavy bleeding or breast engorgement? Do you have heavy bleeding or breast engorgement after the delivery? That should be asked. Okay, you should observe the pallor, pulse, BP, temperature, urinary problem, excessive bleeding, or any foul smelling discharge, foul smelling vaginal discharge. So that indicate puerperal sepsis. So these all things has to be asked. Counsel for the danger sign. Okay, correct position of the breastfeeding. I will tell you how the correct position of the breastfeeding. You have to teach the lady how is the correct position of the breastfeeding. Exclusive breastfeeding for 6 months. Nothing has to be given to the newborn up to 6 months. The nutritious diet, the balanced diet, proper hygiene, use of sanitary napkins. Okay, choosing the contraceptive. Help her to choose which contraceptive will be best just after the delivery. Is it condoms? Is it OCP? Is it mini pill? I taught you the contraceptive. So just post-delivery, which one will be the best that don't affect her breastfeeding? So which one will be the best? So you have to guide this lady regarding all. You have to do hemoglobin estimation once and continue Iron-Folic Acid tablets at least for next 6 months. Okay, what care we are providing to the newborn in postnatal services? This is all free of cost. Okay, so we have to ask the mother whether the child has passed the urine and motion once after the birth. Confirm the passage of urine and stool within 24 hours. The urine should be within 48 hours and the stool should be within 24. It's reverse. The urine should be within 24 hours and the stool should be within 48 hours. Okay, so you have to confirm. The first urine is passed, so urinary passage is normal. There is no congenital anomaly. The stools are passed. The GIT is normal. There is no congenital anomaly. Ask if there is any convulsions. Sometimes there is hypoglycemic convulsions after the birth. Is there any diarrhea or vomiting? So you have to ask the leading question, the newborn. So antenatal and intranatal care include only pregnant lady, but postnatal care include newborn also, along with the lady, the care of the newborn also. Okay, look for the activity of the child. The child is active, the newborn is active, the color, any congenital anomaly, temperature, jaundice, breathing, any chest indrawing, sucking reflexes there or not. You have to observe all these. Okay. That's it. And you have to give BCG, OPV, and hepatitis B. That has to be given just after the birth. Make sure that the newborn got these 3 vaccines just on the birth. Okay. And 1 milligram of vitamin K. Okay, to prevent the hemorrhagic disease of newborn. You know HDN, hemorrhagic disease of newborn, you must have read in patho. So HDN prevent karne ke liye we give 1 milligram of vitamin K injection to all newborn. So make sure the newborn have received vitamin K injection, the first injection given after birth, and 3 vaccines are given. Okay, BCG, hepatitis, you can see BCG, hepatitis B, and OPV. The 0 dose of them is given. So this is how we are completing our postnatal care. So in postnatal care, what services to the mother? Make a list. What services to the newborn? Make a list. Make a list. Minimum 4 visits should be there. On first day, on third day, on 7th day, and on 6 weeks after delivery. And introduction mein you should write the definition. It's very easy if you understand. MCQs are definitely very easy, but writing in university also very easy. We are done with obstetric care. People, we are done with the obstetric. The first half of the session is done. The second half of the session is starting now. Say, got it? Got it? So, essential obstetric care. Antenatal care, intranatal care, postnatal care. Lipika, there are various protocols. The latest BCG can be given up to 3 years. Okay, I will teach you vaccines. A chapter vaccines and cold chain is still pending, in which I will give you detail of every vaccine. If it is delayed, what to do. I will teach you everything. Here, focus on the obstetric portion. Okay, so antenatal care, intranatal care, postnatal care. All the care is done. So obstetric portion is done.